which are a last resort in the most extreme circumstances. We mean a tailored and comprehensive package of measures that strike a balance between protecting the rights, freedoms, and livelihoods of individuals while protecting the health and safety of the most vulnerable members of communities. Ending this pandemic is not about vaccines or, it's about vaccines and. Excellencies, dear colleagues and friends, COVID-19 has now killed more than 5 million people, and they're just the reported deaths. The excess deaths caused by the virus and by disruption to essential health services are far higher. An unknown number live with post-COVID condition or long COVID, a condition we're only beginning to understand. Health systems continue to be overwhelmed. Millions have missed out on essential life-saving health services for non-communicable diseases and mental health. Progress against HIV, tuberculosis, malaria, and many other diseases has stalled or gone backwards. Millions of children have missed out on vaccinations for other life-threatening diseases and months of education. Millions of people have lost their jobs or been plunged into poverty. The global economy is still clawing its way out of recession. Political divisions have deepened nationally and globally. Inequalities have widened. Science has been undermined. Misinformation has abounded. And it will all happen again unless you, the nations of the world, can come together to say with one voice, never again. At its heart, the pandemic is a crisis of solidarity and sharing. The lack of sharing of information and data by many countries in the early days of the pandemic hindered our collective ability to get a clear picture of its profile and trajectory. The lack of sharing of biological samples hindered our collective ability to understand how the virus was evolving. The lack of sharing of PPE, tests, vaccines, technology, know-how, intellectual property, and other tools hindered our collective ability to prevent infections and save lives. And the lack of a consistent and coherent global approach has resulted in a splintered and disjointed response, breeding misunderstanding, misinformation, and mistrust. The fabric of multilateralism has been frayed. COVID-19 has exposed and exacerbated fundamental weaknesses in the global architecture for pandemic preparedness and response. Complex and fragmented governance, inadequate financing, and insufficient systems and tools, voluntary mechanisms have not solved these challenges. The best way we can address them is with a legally binding agreement between nations, an accord forged from the recognition that we have no future but a common future. Nations coming together to find common ground is the only way to make sustainable progress against common threats. It's not perfect, and it's not a panacea. It takes compromise. No one gets everything they want, but that's better than so many missing out on what they need. In 2005, the WHO Framework Convention on Tobacco Control came into force, the first international treaty negotiated under the World Health Organization. An independent impact assessment of the FCTC, the convention in 2016, found it has contributed to significant and rapid progress in protecting people from exposure to tobacco smoke. In regulating the packaging and labeling of tobacco products, in education, communication, training, and public awareness, in banning sales to and by minors, and in reporting and exchange of information. The WHO FCTC is the legal bedrock of tobacco control, which countries have used to implement new measures and to defend those measures from legal challenges. The bottom line, the implementation of the FCTC has helped to save more than 37 million lives and counting, and global prevalence of tobacco use has declined from almost 33% in 2000 to 22% today. The impact assessment found that without the FCTC, it's unlikely that all these tobacco control measures would have taken place in such a comprehensive, coordinated, and effective manner. So, comprehensive, coordinated, effective. Three words that history will not use to describe the global response to the COVID-19 pandemic. Excellencies, dear colleagues and friends, if countries can unite to negotiate a treaty against the human-made threat of tobacco, against the destructive potential of nuclear, chemical, and biological weapons, against the existential threat of climate change, and against so many other threats to our shared security and well-being, then surely, very surely, the time has come for countries to agree on a common, binding approach to a common threat that we cannot fully control nor prevent. A threat that comes from our relationship with nature itself. I thank and congratulate all member states for the spirit of solidarity and the inclusive process that has resulted in the agreed text of the decision that's before you at this assembly. I thank Indonesia and the United States of America for their leadership of the working group on strengthening WHO preparedness, as well as the other members of the Bureau, Botswana, France, Iraq, and Singapore. I also thank Australia and Chile for their leadership in developing the decision that you will consider at this assembly. And I thank the President Charles Michel of European Council for proposing the idea of a binding agreement on pandemics and for his leadership and tireless advocacy. Thank you, my friend. And this is a historic moment, but it's just the end of the beginning. We still have a long road to travel together. Reaching our destination will take negotiation, compromise, and time. The task is urgent, but it also requires patience. The stakes are high, but so are the rewards. A convention, agreement, or other international instrument will not solve every problem, but it will provide the overarching framework to foster greater international cooperation and provide a platform for strengthening global health security in 4 key areas. First, better governance. The governance of global health security is complex, fragmented, and has failed to ensure effective collective action and equitable access to vaccines and other tools. High-level threats need high-level political engagement, which is why we support the idea of a Heads of State Council proposed by the IPPR, the panel, anchored in WHO to provide high-level political leadership for rapid and coordinated action. I propose the Council could be supported by a ministerial standing committee under the Executive Board, which is already proposed and waiting hopefully approval during our upcoming board meeting. Second, better financing. Cycles of panic and neglect have created an unstable and unpredictable financing ecosystem for global health security. Strengthening the world's defenses demands financing that's truly additional, predictable, equitable, and aligned with national, regional, and global priorities. A mechanism funded solely from voluntary development assistance will only increase competition for already scarce resources. WHO supports the idea of a financial intermediary fund supported by a secretariat based at WHO, housed at the World Bank, and financed by countries and regional organizations on a burden-sharing basis. Third, we need better systems and tools to predict, prevent, detect, and respond rapidly to outbreaks with epidemic and pandemic potential. Already, the Secretariat has taken steps to start building some of those systems and tools. In September, we opened the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, a new center designed to enhance global surveillance by harnessing the power of collaborative and artificial intelligence and other cutting-edge technologies. Other initiatives are in development, including the WHO BioHub system to provide a reliable, safe, predictable, and transparent mechanism for countries to share novel biological materials. Several member states are now piloting the Universal Health and Preparedness Review, a peer review mechanism for enhancing national preparedness modeled on the Universal Periodic Review used by the United Nations Human Rights Council. This was suggested by my friend, Ambassador Sambo of Central African Republic, and thank you, Ambassador Sambo, and it's going well. And last week, the Scientific Advisory Group for the Origins of Novel Pathogens, or SEGO, held its first meeting, a new permanent body to establish a more systematic way of identifying the source of new outbreaks. At the same time, we must use and enhance the tools we already have, including the Global Outbreak Alert and Response Network, GORN, and the Global Influenza Surveillance and Response Systems, GISRIS, and the Pandemic Influenza Preparedness Framework. And fourth, the world needs a strengthened, empowered, and sustainably financed WHO at the center of the global health architecture. With 194 member states and 152 country offices, WHO has unique expertise, a unique global mandate, unique global reach, and unique global legitimacy. But over several decades, WHO has been progressively weakened by a debilitating imbalance between assessed and voluntary earmarked contributions that distorts our budget and constrains our ability to deliver what you, our member states, expect of us.
All right, so that was Dr. Tedros Adhanom there insisting that the only way everyone can actually be safe in this world, the way that we can actually overcome the COVID-19 pandemic, is if everyone were to get vaccinated. He said that none of us can be safe unless all of us are safe in terms of having equal access to vaccines. WION is now available in your country. Download the app now and get all the news on the move.